Good morning, everyone, and thanks so much for joining the Clallam EDC Coffee Chat. We are really happy to have our friend and the expert in childcare for our state, Marie Keller, join us from the Imagine Institute. She has helped us. I was just sharing as the Clallam EDC tried to help start a child care center in the Clallam Bay CQ area because that was a desert. There were no child care centers there at all. And she was just absolutely instrumental in helping Cassie, who has now been able to get that going, get that started. So just a few housekeeping items before we let Marie take it. First off, if you have any questions, please either just raise your hand or you can put your question in the chat if you'd like me to ask it. And also, if you'll keep yourself on mute if you are not asking a question, that would be great so we don't inadvertently hear background noise and it interferes with the presentation. So with that, Marie, thank you so much for joining us, and I'll let you take it away.
Thank you, Colleen, and thank you for this opportunity to share. I don't know about the expert in the state. There's so many of those, but definitely a driver and come with years of practical experience, both operating centers, family homes, summer camp programs, and preschools. And this is my life work of about 30 years. I also am really, really thrilled at the work that Imagine is doing. So their goals and their mission as they were founded in 2016 were to support professional development opportunities. And we have grown so much since then in advanced career pathways and all different kinds of things. And most recently, in the last couple of years, I've been sitting on the Child Care Task Force for Clallam County. And we know that there's a challenge, and you all are feeling it. It's impacting the ability to recruit and retain workforce, flexibility in schedules, and all kinds of things. So when Colleen invited me to share the opportunities and some solutions, I was thrilled. So during this time, I want it to feel really open and make sure that we address any questions that you have. You're also free to contact me at any time if you have any questions, thoughts, or ideas, or I can help. So childcare, why is it such a challenge? There's so many reasons. Let's see if this will go. That's me. I introduced myself. My current role is Director of Facility Growth and Development. And I do a little bit of everything, but mostly it's creating solutions that work for the early learning workforce, those that are working in childcare programs, and the community. So what does the community need? How do we support the early childhood educators to meet that need? So today we're going to talk about the types of childcare. Colleen early on said, you may or may not know very much, and it is very complex. We have a mixed delivery system in Washington State, and there are a lot of complexities on licensed versus exempt and how they all operate and work and function. Childcare in the workplace, really, we've done some work and with Shore Metro, and Steve has given me permission to share some of our community listening sessions, information, and other things. Wendy, I invite you to jump in here at any time because I know you've also been doing a lot of this similar work of what we've really learned from employers and the community. The business of childcare, I wanted to just talk about a day in the life of a childcare owner and what that looks like. Again, Wendy, you can feel free to jump in at all the many responsibilities they carry every day. The business and economy and the kind of return on investment and tax benefits for employers who offer childcare benefits. We're seeing more and more publications come out across the US, and then some childcare solutions. The solutions that I'm going to share with you today have all been um, reviewed, researched, and are something that Imagine offers across Washington State and for some of them in other states. We'll have time for questions. And if we have extra time, I have some examples of implementations that are happening in communities. Does that sound good, or is there anything else that I should cover today?
I think that sounds great.
Good. So Imagine, like I said, we were founded in 2016 through a collective bargaining agreement between the state of Washington and the Child Care Union. Family child care providers in Washington State have a union. And that work was really interest-based bargaining. The state wanted some specific things to happen for this workforce, and the child care owners really wanted some specific things to happen. And so Imagine was created, and it's overseen by a joint committee between childcare and the state of Washington. So they really steer our work. Since then, we have really been focused on human-centered design, where the people who are most impacted by the work are the ones who help develop the solutions. So we have expanded beyond professional development into developing a childcare business incubator, and it follows a peer mentor model. So those most experienced are supporting new people in the field. Through that, we've done incredible work, and that's on my next slide, but we'll talk more about it. We've created new pathways to careers. So 3 new roles within the workforce that support the whole system. We have a shared services hub and innovative technologies, and I'm going to be sharing that, Wendy. I'm really excited about that because the business supports on the back end are for all centers and family homes, everyone who is licensed, and they have access to um, everything in the world, including all their required staff training for free. There's also a lot of supports around that too. We do training. It's a core of all of our stuff. Substitute pool relief. We currently have 700 approved substitutes to take the place of a lead teacher in any childcare in Washington State, meeting the state requirements, I should say, because some individual businesses may have other requirements. We have about 2,400 right now in our pipeline. That means they're finishing qualifications so we can send them out to jobs. We need that pipeline because once they start working in those programs, they often get hired, and so we need to replenish the supply. Supply and demand is always the balance there. We do a lot of evaluation and analysis. So we help employers, organizations, communities figure out what it is that they need, how they can solve the childcare crisis that they're facing. And we do a lot of consulting work. So some of our partners are listed here, and Clallam County Economic Development Council, you're on my list, along with Shore Metro, because we're currently working on a project with them to expand access.
So Marie,
Important.
do you have substitute the pool members in Clallam County as well?
We
Or would
have
they travel to Clallam?
I am so glad that you asked that because I did look that up and it looks like there are 3 right now um, active substitutes available. And, this changes regularly. So tomorrow it might be 5 or it might be 0. But I did look it up and found 3. And I think there were 16 in the pipeline. Um, but I didn't dive deep into the status. Do they just need to renew their first aid, or it's usually a renewal of some kind or a training requirement that needs to be met? All of our substitutes have access to free training to meet those qualifications. So we've reduced that barrier, and training is available in multiple languages. So if they prefer that content delivered in a different language, that's definitely happening too. So our business incubators, I'm just going to toot our horn a little bit because we've opened over 700 new family childcare businesses. You'll understand why that's so important in a minute when we talk about the supply and demand. Um, and that is through that peer mentorship model. So that increased childcare access by about 7,000 slots. The Shared Services Hub has about 50% of all licensed providers in Washington State in that hub. We delivered and we just launched this year staff training, 13,000 hours of training for their staff. The hub is free for them to join and participate. There's no requirements of those childcare businesses other than to utilize the services and provide feedback and share what their interests in, what they need to be successful. 92,000 hours of professional development delivered directly to childcare providers, the subpool. So we've delivered 450,000 hours of release time to Washington State Child Cares. We also have a 92% fulfillment rate. So if a child care makes a request, there's a 92% chance that we'll meet that request. And we have some tips and tricks on how to make your request be accepted. And our team goes to the mat to find somebody. If it's not getting accepted quickly, we really work hard at making that happen. We provide a lot of technical assistance across the ECE systems, navigating the multiple systems that you have to use in the EC in this workforce, like WACompass and Merit, the Professional Development Registry. And we also supported stabilization grant development and understanding the rules, regulations, record keeping, and requirements of receiving a grant. So we helped 6,000 providers over the last couple of years um, obtain access to those grants across 38 counties. And total disbursement of funding was 290 million. So that was a big push, and we continue to support the ELF grants as well. ELF grants are early learning facilities grants.
And I
Consulting.
think,
So
yeah, I think Shore, Wendy, is that right? Shore Aquatic Center received an ELF grant. Who else did locally?
And the YMCA
YMCA.
and yeah.
Okay, great.
I'm not sure if there's one more. There might be one more, Marie. Isn't there one more in Squim that had an ELF grant? Can't remember, but
yay.
we've been well supported on the
Yeah.
peninsula.
Little Explorers had a small one, I think, to do some renovations.
Okay, that's
Yeah.
right. Yep.
But there's minor renovations in addition to the expansion ones. So,
Yeah, minor renovations and inclusion grants, really building out your program. You might need some special equipment for a child with disabilities. And so there's also some grants and support for that, which is really helpful. So I want to talk about the childcare landscape. And this lens seems to be the hottest topics or the most concerns are what does the access look like? The cost. Cost is a big driver in childcare, and it's so expensive. But operationally, when you talk to childcare providers, they're often going sometimes without a paycheck or earning less than minimum wage themselves so that their staff gets paid and all the operations happen. So that's definitely a key area we want to talk about, and the need for all of those grants to exist so that they can keep their doors open. And then flexibility. Often we hear from families that childcare is just not available the hours that they work, or for overtime, or just anything extra. So the different types of childcare are there's family, friend, and neighbor, or nanny, what we would call an exempt. They're not licensed. Um, Nanny care is usually arranged by an organization, but can also be a personal relationship where the family privately pays for that care. The nanny generally comes to the family's home and maybe offers some wraparound support. Sometimes they do some extra errands or services, take children places, maybe drive them, and everything is regulated by the family that hires them. So if there's a background check, that family does that. Supervision and observing their skills, and that's all on the family. Family, friend, and neighbor care is similar. It's usually somebody already known to the family and happens kind of organically. I need this. You're available. Are you interested? There's also a subsidized family, friend, and neighbor program where the state helps those farthest from opportunity pay the cost of care. That is a very low amount. It's $4 an hour per child. And so it's not something that is likely long-term sustainable. We see state subsidized family, friends, and neighbors are generally relatives that do this long-term stopgaps while they're looking for care. And about 6 to 12 months is about the length of time that most subsidized family, friends, and neighbors are within that system. There's rules and regulations for exempt care that require they can serve one family. They can't have, a dozen kids show up every day, one family at a time. And otherwise, they need to be licensed. So licensed family child cares and centers are have the same guidelines with the state of Washington. Those were aligned in 2018. And that really drives the health, safety, quality practices that happen in those programs, and also gives them about 200 pages of code to follow. That's what Colleen meant when she said that Cassie really needed some help out in Clallam Bay to get her childcare center up and running. Navigating through those rules, as Wendy might also share with you, can be a challenge. The differences between those two are family child care has a maximum capacity of 12, and that care happens in the provider's home. In a licensed child care center, they need to mean and those kind of qualifications. And children are often grouped by age group. There has been a little bit more flexibility the last few years at broader age group expanding combinations, but it is limiting and does require additional staffing, which doesn't balance the budget very well. So those are licensed programs. School age care is also in really high demand. And some school age programs are licensed and some are exempt, and some are what they call authorized. So they might be operating at a school site program exempt from license, but they can offer subsidy. We see that a lot in programs that operate on school grounds and in tribal communities. Preschool and Head Start as well. So we have a state-funded preschool program called ECAP, and it's Early Childhood Education and Assistance Program that really does a lot of wraparound supports, including the family. And Head Start is a federally funded program that we operate in our state. Any questions on those types of care?
There's a lot of different flavors of it, that's for sure.
Yeah, I think there's a lot of value in that parents' choices are preserved. And with even though licensed facilities have really strong guidelines, the second highest of all states in our country,
What state has the highest?
New York.
Okay.
And it's been consistent that way for about 20 years. And above that is the military. Military guidelines are a little bit higher level. So our state standards are really intended to drive not just the health and safety and wellness, but also high quality practices. I was going to say something else. Oh, they're still operated very individually. So you do have a lot of flexibility in your curriculum philosophy or really the style of teaching. So preferred choices still are very apparent within those licensed facilities. So that was what we just talked about, licensed childcare in Washington State, staffing, the ratios. One of the biggest challenges is having enough staff for the number of children, and those vary greatly depending on the age of children. And so we're always thinking about that. That's probably a number one priority for a director in any childcare. It also sometimes can affect the flexibility. So if a child needs to stay late, but they're normally scheduled to leave at 3 o'clock and at 3:15 you have a school ager coming to fill that slot, you would be over capacity and unable to care for one of those children. So that is definitely something that plays a part in this. So Daly and Wendy, feel free to jump in here. I really tried to think about kind of the responsibilities or a day in the life of childcare providers as kind of daily and then routinely. There's so many, many more that we could add, so I categorize them in different ways. Greeting children, parents, and staff is always a priority for every program. Welcoming and managing the child developmental needs, individual and family plans. And so those are high priorities and something that happens continuously all day, every day. Child and staff observations, meeting and supports. So we want to ensure that our staff is supported and able to meet the needs of children. We also need to observe them for health and wellness and children for their developmental milestones. Then we have meetings with parents where they're partners in this work. So we all work together to ensure that children are ready to move to the next stage or navigating a challenge that's happening with them. Janitorial and facility maintenance, having a safe environment and clean environment is high priority. Maintaining the child to teacher ratios, healthcare management, and that goes across the board for staff, children, everyone. Nutrition and kitchen management, policy writing and enforcing, safety and risk management, and planning. This all takes a lot of planning for enrollment, planning for curriculum, routinely marketing, outreach, communication, enrollment and administrative management, operations management, HR, staff development, leadership, coach, mentor, credential management, lesson planning and supports. We could go on forever, but really what I wanted to say is for most companies would have 10 to 12 people doing the role that a director in a childcare center is doing. But they're just not big enough to do that. They're small businesses generally. And so it's a struggle to meet all of those requirements and do them. This is one of the reasons why we started our shared services hub, or and some of our like the YMCA has a lot of built-in supports across all their programs because they operate so many. So they can leverage some additional supports because they're part of a bigger organization. We're creating that bigger organization in the hub so that all of these small independent businesses have access to some of those supports. Accessibility. This is like one of the biggest challenges, and I know this is why you all might be feeling a challenge in businesses and the economy in Clallam County. American Center for American Progress does a lot of reporting and has been doing this since I think their first report came out in 2018. But approximately 63% of Washington residents live in a childcare desert. What that means is that there's less than 2 slots for every 5 children. So there's not enough supply to meet the demand. We have the 6th most severe childcare shortage in the US, right here in Washington State. And DCYF was the Department of Children, Youth, and Families that regulates childcare. And they estimate that about 302,000 children birth to 5, so before they start school, need care that isn't available to them. And so that need is established. Washington STEM does that work with those numbers, is that both parents or all available adults in the household are working, and the 302,000 young children are left out. There's an additional 469,000 children in our state that are school age, 6 to 12, or already in kindergarten to 12, that need care. So combined, that's, 770,000 children that are looking for care that don't have it. We have to build a supply. In Clallam County, I have some numbers for you in Clallam County so you can see what that looks like. We're currently meeting the estimated need across all age groups of 12%. So
That's not a passing grade.
that is not a passing grade. That means, 1 in 6 kids has access that needs it, when their parents
What
are
are
working.
what are the drivers of why our county is worse than the state average?
We see this typically in rural communities, but it can also happens in urban communities. Some zip codes have no childcare. And I think it's a variety. One big thing that is happening in Clallam County is childcare providers are aging out. We also had some rules and regulations in 2018. Our regulations increased greatly with teaching credentials or college requirements, college level education requirements. And while at the same time they did maintain equivalencies to that, experience, knowledge, and community-based trainings are an approved method of obtaining that college credit. It wasn't widely known. And so we did see a big exit when those became a requirement. I've been doing this for 20 years and now you want me to go to college and get a degree? I'm out of here. It's just this is too much. I think the other challenge is some of the other reasons are the cost of care is really high for families, but the bottom line is really low for childcare businesses. It's not something that you do to make money. It's something that you do that's a public service for sure. And most people get into this business because they love working with kids. Maybe they open a family home childcare because their children are young and they can't afford the cost of childcare and work, if they work, So they open a childcare home business, and then maybe they do that for 10 years and rejoin um, the workforce in another capacity. There's all kinds of reasons. If anybody else knows of any particular to Clallam County, I would love to hear them, but I know aging out is a big one.
I would just also add, the educational requirements are such that individuals who could choose childcare as a profession can go into education, into K-12 public education, and make significantly higher wages. I think one of the challenges with the business model for childcare is it's very difficult to
Oh,
pay thriving wages for employees.
Wendy, thank you for that. And benefits. Um, most people who work in early childhood education, a very high percentage, so not all, do not have access to benefits through their employer or retirement or any other of the broader benefits that we look for as in a quality job. And so that's definitely causes a lot of turnover in the field. And like Wendy said, they can go to the school district and have a pension, benefits, insurance, retirement, uh, and maybe a little higher wage. What if childcare was part of that public system, public education system? It might look different. So additional access, we did a lot of work and surveying and information around Clallam County. So we're serving approximately 1,085 children, and these numbers change regularly too, across 16 licensed family childcare businesses. This is all of the county, and 19 childcare centers and 3 school-age centers. So that's right now the existing business, what it looks like. And I pulled these in July of this year. Just so you know, the dashboard is updated quarterly, but the last update I looked last week was July. 12.54% of the childcare need is met across all groups. And the highest needs seem to be around preschool and school age care. So they have the least amount of access. In a lot of communities, we see preschool having the most access because of Head Start and ECAP programs. But in Clallam County, that's not the case. So affordability, how do families pay for childcare? Pay themselves. They use subsidized care, and there are a few employers that offer stipends or benefits, childcare benefits, similar to offering healthcare benefits. So the state subsidy, and there's a tribal subsidy as well, is the only subsidy that really is accessible to all families in Clallam County. A family of 4 earning about $6,500 a month would be eligible for the state to share in the cost of care. And they use the state median income. It is household income, and they look at the size of your household. How many people live here? How much income is there? And do that calculation. And then the co-pays, the parent portion of that, is a sliding scale based on their income. So that's how that subsidy works. There are other municipalities that have also added a subsidy. King County has a higher eligibility threshold. So if you do not qualify for state subsidy because you make too much money, they will kick it up from 65% of the state median income to 80%. And those families have access to a subsidy that is through a tax levy. The challenge with that is they have a 2,000 family wait list. So it's just a 15% different income eligibility and 2,000 more families. The city of Seattle has operated a subsidy for as long as I can remember, and it goes to 94% of the state median income. So in both of those programs, you need to live or work in those areas to qualify for those subsidy programs. Affordability continued. This is some of the work done by your local coalition, and it's Tri-County. So this is the North Olympic region in partnership with STEM. But it really tells you how many children are in the community. Kitsap, Jefferson, and Clallam has 24,000 kids. We know there's only 1,000 in childcare in Clallam. They're the biggest. More kids live there. I pulled this because I thought it was really pertinent, and also so that you would know that there are a lot of people working to solve this crisis. Most families in this community are paying about 30% of their income for childcare. So we did a lot of community engagement. As I mentioned, what we're hearing from working families and parents is that they're not able to start a job or they lose a job due to childcare challenges. With that limited supply and that high cost, sometimes they just can't find a spot. They get hired, but they can't find childcare. So they're delayed or just can't even start that job. We also have seen parents leaving the workforce to provide that childcare for their children. Missed work, late to work, or they need to leave early. They're passed up or passed over for a promotion because they don't have the flexibility needed and the hours. They had to quit or disenroll in an apprenticeship or training program. They miss advancement opportunities. And for all of them, a financial hardship has been experienced across all families, working families with young children. What we hear from specific in Clallam County is that health and wellness for families and children were highlighted as important considerations. So that is primary, long-term advantages of early childhood education and social emotional development, financial wellness for the parents were those priorities. We also heard that hours and accepting children across age groups. So one family, if you can imagine, might have to take their infant to one care provider, their preschooler to another, and their school-age child to another. That parents want one-stop shopping, if you will, a child care that serves the children across all age groups. With a limited supply, what we see is, I have an infant opening, but I don't have a preschool opening. I have a preschool opening, but not an infant opening. And so the child cares themselves are not able to accommodate a lot of that. And the ideal hours to operate would be 5:30 a.m. to 8 p.m. And that was what parents said are the kind of work hours that they need. Most childcare businesses are open between the hours of 6 a.m. and 6 p.m. It's unusual to see outside those hours and very unusual in Clallam County. They'd like to drive about 10 to 15 minutes outside their normal commute. So between home and work, 10 to 15 minutes is ideal. If they have to take a different exit, go a different way, go into a different neighborhood, that would be ideal. They're also seeking backup childcare for when their program is closed, sick care, and drop-in care for families who have to work an extra shift or an extra day. Affordability is also a big factor. So we launched a survey in 2024 in April and closed it in May. So for about 4 weeks, this survey was open and we had 100 people answer, which was fabulous. So we learned so much about what was happening in the community, and I wanted to share this with you. This is predominantly people who lived in Port Angeles, but it was really across the county. Um, Most families are looking for care. The blue is really none. Orange is one child in that age range. Yellow is two. Green is three. And so school age and preschool care were really the highest needs requested, followed by infant and then toddler. So we do have a new infant toddler center operating in Port Angeles, and that's pretty exciting and might be driving down some of this. So 75 of the families responded with a request for school-age childcare. And we know according to the numbers that we saw, only 6% of the need is being met in school-age care. 55% are seeking care during non-school days, breaks, 62% during summer. 50% of the families are seeking care after school only, and 4% need care before school and 20% before and after, if that makes sense. If you've been a parent and navigating school, you know those school closed days, you're always scrambling, trying to find, what am I going to do with the kids? In years past, and in my time, when that happened, we went to our grandparents. But grandparents were retired by then. Today's world, grandparents are still working, a lot of them, or they might not be in the same community. When school has late start, that's also an impact to families. These are good things to also understand as employers, if you might have the opportunity to provide flexibility on those days. We also met with employers. So I think 12 employers responded and really shared their thoughts on how childcare is impacting their business. The top one here is a lack of childcare is affecting their ability to retain employees. So we've been seeing exits from the field. School age care is more needed. It's interesting. Employers really have their finger on the pulse in Clallam County because it aligns really with what the parents are saying. Also a need for weekend care. 100% of those employers helped distribute our survey, which was helpful. And they also brought up transportation could be important. They have employees leave work to pick up a child from school to get them to their after school care, and then go back to work. So transportation could really help with that. And employers, most of them didn't know who was using subsidy and who's not, but we know within our license system about 50% are subsidized in the county. Availability seems to be a greater issue than affordability. We know that because we just don't have a lot of access. So, business and economy. Washington State Department of Commerce has established a task force and reported to the state, our state legislature and governor, on all the childcare challenges. And there's a cost of care report. If you like to read, it's a really great read that talks a lot more in depth about what's happening across our community. But our economy loses an estimated 6.5 billion every year due to childcare challenges. That is a lot of revenue that is lost due to a problem that has solutions. We can solve this. Some national trends. The Boston Consulting Group studied 5 different companies that offer employee childcare benefits. And all 5 of them experienced a return on investment ranging from 90 to 425%. That is nice to know. We hear that from parents when their employer is offering childcare benefits, they're 90% of them say they're as valuable as healthcare benefits. And we've done also some studies, and the report that is referenced in this, and I'll share this slide deck with you. The cost of replacing an employee is often double that of the departing employee's annual salary. And so retaining just 1% of your workforce could often offset the cost of childcare benefits. There's also some great tax incentives, which a lot of employers don't know about. So we're going to talk about those too. But I'd really like to open it up and think about, how is this landing with you? Is it helping and understanding? Do you think that there's some solutions in mind that could really work? Jim, see your hand raised?
I do, as is typical. Strong parallels here to the ongoing discussions about housing supply, with the regulatory barriers, I'll call them, to increasing supply. Supporting demand is only one part of the equation. It's supporting efforts to increase the supply, and maybe rethinking some of the regulatory barriers, I think, is just as necessary, maybe more so. Because employers can, if they've got the financial capability, can support their employees, but if there's no supply, that money has no effect. Doesn't move the needle. So talk a little bit about thinking more carefully about the market barriers. For example, you talked about the regulation that now requires a college degree for an employee at a child care center, if I heard that correctly. That seems to be a little bit
Yes.
self-defeating. So talk some about that, the supply side.
Yeah, I think that is one of our solutions. We have to create more supply. Regulations. I'll tell you, I sat on the negotiated rulemaking committee for 3 years and hashed out these regulations. And our state brings together people across the workforce, so preschool, Head Start, ECAP, childcare, family homes, childcare centers, and then State Department of Children, Youth, and Family to hash out regulations. And Washington likes to be a leader, and safety is trusting the care of your child. I think parents want the state to regulate so that those safety regulations are high. Education is important in this work, but like you said, I think when regulations are too high and we see a mass exit, we have to learn from that. And so Imagine does offer, and now for free, we have negotiated with the state to fund all of the equivalency training, so they can, for free, get community-based trainings to meet those requirements. We also, through our Early Achievers program, which is a quality recognition system, have scholarships available. So there's a lot of support to get that education. And I think it's awareness. Some of that is also awareness and understanding. When those regulations come out, they need to come out with, here's the ways you can get that. Here's the ways it doesn't have to be, you have to work 60 hours a week and go to college because that's not practical for everyone. For most people. Increase in supply, I've got some solutions coming up. There are multiple ways that we can increase supply, and some are things that we're already doing, and some are things that we want to be doing. We highly recommend having a deep understanding of what your workforce needs and having them give input. And I can share some examples if we don't run out of time. I think we're going to run out of time, but I have a couple examples documented in here that I'll share this slide deck with you, or Colleen will. Some of the solutions are childcare hubs. And we offer that childcare hub with the business back end and connections for early childhood educators. They can get everything that they need through that hub in professional development, business supports like QuickBooks and accounting system, consultations with professionals outside of their staffing, HR supports, really all of those kind of things. We now have a big interest in employers joining that hub to help navigate policies in their workplace, understand the tax incentives of doing so, and stipends or supports or some other childcare benefits that may help their workforce. Our business incubator, like I said, we've opened 700 new family homes. We're also on the verge of our 6th childcare center that are all independently operated. So employers can open a childcare center if that makes sense. Maybe they have extra space on site that they could dedicate to childcare. An on-site childcare center could be amazing. Technical assistance. If employers offered technical assistance or contracted with the hub to offer technical assistance for their employees to apply for subsidy, 1 in 5 families that are eligible for childcare subsidy even apply. They don't even know it exists. As a licensed childcare in the 90s, it was 7 years of operating my business before I knew that there was a childcare subsidy. And so also on the opposite side of that, childcare providers don't know it exists. Those 7,000 new slots, those 700 new childcares, every single one of them gets an incentive when they enroll their first subsidized child. And so we are creating that awareness early on for those new family home businesses. And stipends, just that cost. What we also heard from employers and childcares is I could justify being open extra hours earlier in the morning, later in the evening, maybe one weekend a month or every weekend if I had full enrollment or an incentive to do so. And so we think that that's a great way to do it. And there are tax incentives for any help that you give related to helping offset the cost or finding childcare or connecting to childcare subsidy as an employer. So those are all things that you can directly support and things we want to leverage, maybe small employers coming together and being able to access so the cost could be small to support the broader, bigger impact in increasing supply and cost and increasing flexibility. If you're an employer that always you have shift workers or hours outside of the typical 7 to 5 hours, that might be something that you want to consider. How do I leverage some after 5 care hours? We also, Wendy, I would invite you to talk about your expansion, but Shore is also in the design process right now of increasing 110 new childcare slots in the building right adjacent to Shore Metro, the pool, Shore Aquatic Center. And so that'll be 110 new slots that we hope will open in 2025. We just had a new infant toddler center open up. I think that they have 60-ish childcare slots, and the YMCA is also in the process of a big expansion. So we have 3 committed community action items that'll increase about 10% of the slots. We are still far below the needed supply. So happy to talk individually about ways that your organization, what might be a good fit for creating that supply or offsetting the cost or really just helping your employees. So we've organized some of these into the accessibility, affordability, flexibility. Often one solution doesn't really fit all. And we've also organized it in, your focus area, cost, timeline, impact, operational complexity, and financial commitment. So if you want to open a childcare center, it might take longer than helping family childcare businesses get opened up. Those are pretty quick to open because they already have a facility. They don't have nearly the zoning and building constraints. Technical assistance, you can get that implemented quick. Providing childcare stipends, we can get that quick. Just thinking about what's the eligibility criteria, who has access, and then the reporting requirements. Incentivizing non-standard hour care is also pretty quick. So if any one of these are the biggest struggle, we can help with those solutions. I realize that we're at time, and I'm sure Colleen probably still has some things to share, but I do want to make myself available for any questions, feedback, or things that might be helpful.
This has been great, Marie. Very wonderful to learn more about the details and the drivers behind these challenges. Would you put your email in the chat for everyone in case they have any questions? That would be really helpful. And then yeah, I think that we can have people email you if they do have questions. So
And
really,
Colleen,
yes.
you're going to share this?
Yes, we put it on our
our-
website. Mitch will have that up on our website by the end of the day.
That's great. I have a little QR code that'll take you to our website, and you can
Okay.
make a request there as well as emailing me directly.
Okay, terrific. Well, thank you so much. We are at 9 o'clock, so I'm going to call it a morning, but we so appreciate your time and your expertise in helping us so much out here, navigating these complex waters so that we can, help our families and the kids that need this support.
My pleasure.
Yeah. Thank you, everyone. And Merry Christmas also. I guess we'll be taking a couple weeks off. So have a Merry Christmas, everyone. All right. Bye-bye.
You.
Bye.
Thank you.
Thanks,
very
Mary.